Good afternoon, everybody, and welcome to today's Facebook Live. I'm your Director of Emergency Management, Alexander Falcone, and I'm joined here today by our city's Medical Director, Dr. Peter Antevi. Obviously, this COVID virus has been really a whirlwind over the last couple of months. And with the recent increase in cases and the recent changes to some of the data that we're seeing coming out of the Department of Health, we wanted to host this Facebook Live question and answer to address your concerns and provide you with the most up-to-date information that we have here in the city. So as a reminder, during this entire broadcast, please feel free to post your questions in the comment section. We will try to address them here in our Facebook Live. If we don't address them today, we will answer your comments. So if you have a question, please feel free to put that in there. Dr. Antevi, I'd like to start off first by talking about some of the numbers that you're seeing and some of the data trends that are out there. Can you please give us an overview?
Sure. Hi, Alex, and hi, everyone. Coral Springs, Peter Antevi here. First, before I show the dashboards, let me just describe a phenomenon that I'm encountering every single day, seems like every single hour, which is people calling me, really in a panic for help. And why I'm saying that is because you don't really know what to do until it happens to you or your family member, and then things start to get ramped up. And so I really want to impress upon people as I go through the numbers here, just to think about how to maintain your family, maintain your business safely, so that you don't end up in a situation where you're wondering what to do next. And so I can't tell you enough how people just think it's not going to be me until it's them, and then the phone calls start to happen. And so why don't we move on to the dashboard, and which we have up here on the screen. And I want to take you all through this step by step. There are multiple dashboards. And so, of course, the dashboards may not exactly line up because the cases are in flux all the time. But let's start here with the state of Florida as a total. You could see the total positivity rate. The new cases, again, this number is not reflective of today, July 13th yet. It's going to be updated here shortly. But you can see here that the death rate, the death number is 4,346. Current hospitalizations are 7,499. And then the available ICU beds, and that's across the state. And then the newly reported deaths today are 45. But now I'm going to go to the upper right-hand corner here and I'll switch just to Broward County. Okay, obviously that's where we're concerned with. And you can see here that the number of COVID positive people, the new cases today, and the currently hospitalized. But what I want to really talk about, what's most important here, is the hospital capacity. So let's move on to this next dashboard here. And before I do that, Alex, let me move on to the right side of the screen. And you can see clearly here that the new cases by week has dramatically increased. And we're all experiencing that. We all know that to be the case. Sorry about that. Okay, fix that problem. That's my phone all day long.
Hello?
Let's move over to the hospitals here. So the hospitals, you can see here, this is again for Broward County only, and you can see available ICU beds are now down to 12% only. And if I scroll down here to the hospitals that are in our area, so let's just talk about Broward Health Medical Center. That's again in Fort Lauderdale, 7 ICU beds available. Broward Health North, 1 ICU bed available. Cleveland Clinic, 9 ICU beds available. Sorry about that. And then we have Florida Medical Center, 0 ICU beds available. Holy Cross Hospital, 3. Let's keep moving down here a little further down to Memorial Hospital. West has 2. Regional Hospital, the largest ICU here, has 15. Northwest Medical Center in our area, 7. And then you could see here University. So you could see here that the number of ICU beds we have available to us is dwindling. And this really is the big issue for us here in South Florida. It's not that the number of people, infected over time is going to change. It's the ability of us to care for those people that's going to change. And that's what's concerning me the most. So Alex, I'll stop there for any other commentary.
Thanks, Doctor. I think that's really good information, and the information that's really useful for us at the city is the return of percent positive tests. So while our cases are continuing to increase, we're looking at how many tests are actually coming back positive for COVID-19.
Yeah.
So in the state of Florida, we're breaking records with the amount of tests that we're performing. So folks, I've heard folks saying if you test more, you're going to have more cases. And that's absolutely correct. There's a lot of merit to that statement. However, if COVID is not widely spread in our population, the percent positive should remain the same or drop with the more tests we do. So if only 5% of the population has it, I continue to do more testing, I should see a 5% return across the board, whether we do 10 tests, 100 tests, or 1,000 tests. What we've been seeing over the last couple of weeks is that percent positive return increasing. In some cases, Broward County was close to 20% returns. We're averaging about 15% return. And so that's what we're using as an indicator here at the city for our decision making when we decide what we're going to do next. So keeping all this in mind and looking at the increase in cases, the increase in the return of percent positive, we have decided beginning today that we are going to limit public access to certain city facilities. So City Hall, our public safety complex, the water treatment facility, and our West Side Garage and Humane Unit are all going to be limited for public access. If folks need assistance, you can always call our non-emergency line at 954-344-1800. This is a precaution that we're taking to make sure that we're keeping our staff safe and we're keeping our residents safe so that we can continue to provide you the services that you need. To be clear, none of our services are shutting down or stopping. We're going to continue our services. We're just limiting the public access to those general lobbies or other areas. Building plan review and drop off. You can drop your building plans off at City Hall. We've arranged for an outside drop off so that we're staying, safe and we're staying healthy. Dr. Antebi, on this note, I wanted to discuss with you, we're getting some questions from Miriam asking about a backup plan for ICU patients. And I also have another question from Michelle about whether or not COVID is airborne. I know that you just spoke briefly about the hospital capacity and numbers. Can you talk a little bit more about our contingencies if ICU beds do fill up? And can you also address the question related to whether or not COVID-19 is in fact airborne?
Okay, I'll start with the easy one. It is absolutely airborne. We've been saying that since the beginning of this, and I know that there's kind of conflicting reports coming out of the WHO. This is undoubtedly airborne. Okay, so let's make no bones about it. All the scientists have said that. You have to understand when these large entities, CDC, WHO, make policy recommendations, they're balancing the politics, the finances, the ability to deploy logistics. And so if you say, for example, to the world, this is airborne, that now strings a domino effect of, okay, airborne, what does that mean? Okay, it means you maybe need a better mask. Perhaps it may mean that you need to have eye covering, which is why when you go on a plane today, if you go on a plane, not really advised, just by being in the same air cabin, even though they're doing all the right things, it could get in through your eyes, mucous membrane. So you'll see people now on an airplane with shields on and goggles, just like they're working in an emergency department. So that is, first and foremost, I think a very important issue. And what was the other question, Alex?
So we had a question from one of our residents about a backup plan if ICU bed capabilities were exceeded.
Yeah. So the very important thing to know is that hospitals have to run their operation on a day-to-day with elective surgeries, outpatient things going on, colonoscopies, all the regular things. Once the levels got to the numbers that they were getting to, most, if not all of the hospitals have now had to ratchet back and say, no more elective surgeries. Let's open up those ICU beds for COVID patients. So there's a little bit of room to flex there, but not much. More importantly, and I think Most people who are not on the inside don't recognize this. Some people have beds, they have rooms, they don't have nurses, right? The nurses are the lifeblood of a hospital system, okay? Make no two ways about it. If you don't have an ICU nurse, one nurse for 2 patients, then you could have 1,000 rooms. So now they're trying to bring in nurses to help out because there's a massive shortage. So even if we ramped up and built an exterior tent city that we can house another 1,000 ICU beds, you have to staff it appropriately. And so I'm very concerned about the fact that we may have the physical space, but we don't have the human capital available to help us out. And so I would caution everybody that if you look at the numbers and what the numbers are doing, and just look at the number of people who are infected, until we get to herd immunity, we may be looking at an average in the United States, because of kind of where we're going now, at around 50,000 plus cases a day for the next 365 days. Okay, so and that's just a simple mathematical calculation that we can do based on the United States numbers, where we are, and the fact that our mitigation strategy wasn't deployed in a way that allowed us to kind of reduce that curve. And so I think we have to really come together, understand as a city, as a county, that it all depends on our citizens, our residents, to make sure that they kind of do the right thing so that they don't end up as another statistic on this dashboard. I hope that answers the question.
It does. Thank you, Doc. And a little bit of background for the residents at home. We did get word that the Florida Division of Emergency Management has been working with the federal government to actually bring in nurses from outside of the state. So Dr. Antebi addressed the issue with nursing capacity and how the staff at the hospital is just as important as the total bed count. So those additional nurses that are coming into the state, we're certainly very thankful that they're coming down to help us out, and that will help to expand the capacity that the doctor just spoke of. One of the things that we've been stressing for residents at home is to get tested. If you have signs and symptoms, it's highly encouraged that you get tested for COVID. If you know that you have this disease, you can make sure that you're taking extra precautions to protect your neighbors, your family, and the public at large. If you go to our website, www.carlsprings.org/testing sites, we actually have a full listing of all locations where you can get tested. So we're running a public testing site at Mullins Park, at Mullins Hall, which is right in the center of our city. We also have a FDEM walk-up site at Sample and Carl Ridge at the public site. But there are other areas around the city that you can get tested at. There are private options if you have health insurance. And if you do have health insurance, the test is at no cost to you. If you don't have health insurance, we have numerous free sites either in the city or located elsewhere. And we're also offering free antibody testing this Friday at our Old City Hall site. So we're doing a blood donation where if you donate blood, you will be given a free antibody test as well to determine if you have been exposed to COVID-19. When folks go and get tested, Doc, I was hoping you could outline to them what steps they should take prior to going to get tested. And then once they do get tested, as they're waiting the results, what would you recommend that folks do during that time period?
As far as testing is concerned, I know that a lot of people have been waiting in long lines and so forth. But what I would say to you is you have to see what is the urgency of your testing need. Some people need it for travel. Some people need it because they're ill and they're not feeling well. And you have to understand that not every testing site is created equally. There are test sites that you can get more rapid turnaround times. And then there's some where I've heard people wait up to 10 days to get their results back. And again, we just have to hope that that gets better over time. There are some rapid tests that are available within 15 to 30 minutes, but we're finding that those are showing a lot of false negatives and giving people the wrong information. And so I would say, know the test site, ask all the right questions before you go to that test site. If you're really in a rush to get the results back, then you would have to really ask those questions and say, hey, what's realistic for me to get those results back for testing? And, there's going to continue to evolve other options for cities to actually get their folks tested. We just need to ensure that that turnaround time happens quickly. And I think that's all really I could say about testing is just no one testing site is the same. And the reason is because we're using different labs. So I'm personally dealing with two different labs. The state of Florida has contracted with other labs. And so everywhere you go is not really the same. That's really the best way to say that.
Thank you, Doctor. I want to address a couple of questions that we're getting from residents here. One of the questions was concerning the timing. Dawn asked, what about getting results? People are waiting a long time for those results. And that's an excellent point. We're hearing in some cases that folks are waiting up to 10 days to get results back. And that's actually an indication of a couple of underlying issues. As Dr. Antebi just mentioned, there are multiple partnerships with multiple different laboratories. And so every testing site has different relationships and contracts. When we're in discussions with these labs, a lot of times what's holding up the result is two different factors. One, the volume of testing that's occurring. These labs are getting inundated with tests from around the state. The second is that there are certain shortages of the supplies needed to actually test these swabs. So once your swab is collected at the testing site, it's used as a sample prep kit, and then it's used with a reagent to determine whether or not you have COVID-19 if you're positive. And so some labs have been having issues with supply chain issues, getting the reagent and getting the sample prep kits. So those are two of the underlying issues that have started to hold up these tests. Overall, most of these labs are realigning their priorities. Sun Sentinel actually ran an article this week that outlined private labs pulling back testing from private clinicians. So the labs are focusing on servicing the DOH testing sites instead of private doctors' offices or other locations. So as these labs start to reorganize, as our supply chains start to improve, I anticipate that those wait times will get shorter, but we just need to be patient and deal with it. What's important for us to know is if you are waiting on your test result to come back, whether you're waiting 2 days or 10 days, it's important for you to stay home and keep yourself isolated. If you are COVID-19 positive, we want to make sure that you're not spreading it to other people in the community and doing your part to keep our community safe collectively. I'm going to answer a couple other questions here, Doc. We have a question from Carol asking, how would we assess the risk of swimming at the aquatic center? I would say that overall, I think that the aquatic center is a very safe place to be. We did close the facility down as a precaution last week in order to test all of our employees that work there. So thankfully, we did have a COVID positive employee. Thankfully, all of our other employees came back negative, and we were able to reopen that. Studies have shown that sunlight and fresh air are great things to prevent the spread of viruses. And so I would say that that's a safe place for folks to swim and work out. With that, Doc, I was hoping that you could go a little bit more into how the age of folks who are infected is changing, what the median age looks like, and also was hoping that you could touch a little bit on the mortality rate associated with this. I know that we've watched that rate actually decline over the last couple of weeks.
Yes, happy to do that, Alex, and thanks for the question. So I have a couple of graphics I want to put up here. Here is number one. This is for Broward County. Let's start with the middle, the resident cases by age group. And you can see what's happened here, that the shift in the number of younger people has occurred as expected. On the left-hand side, you could see cases by race and so forth. On the right-hand side, you could see the total number of pediatric cases, long-term care cases, long-term care deaths, and prison cases. So I think that's kind of item number one. But let's dive into that a little bit deeper. And what I'm going to do is I'm going to share another graphic here. Let me stop that share and start another share. And it's right here. So what I have here, Alex, is the COVID-19 summary for Broward County. And this is, again, very up to date through July 2nd. Let's start here at the top aspect of this, you can see here that this is the cases in Florida residents by date confirmed. And you can see here just the number of cases. And then you can see here the median age. So you can see here that the median age here is stated to be at 39. And that's for Florida residents. Now let's dive a little bit deeper into the, and again, remember, this is Broward County only, right? I'm not talking about the state as a whole. That's why you see the numbers as a little lower in the case rate. Now let's take a look by ethnicity, the cases, hospitalizations, and deaths. And you can see here that, you know, white versus black versus Hispanic and so forth. And you can see here that the number of cases, hospitalizations, and deaths, you can see those percentages here for Broward County alone. And then let's move down here to, well, I think the question was, and I'll make my screen a little larger here, is the age group. So you can see here that the number of cases, all cases, new cases, hospitalizations, and deaths. So let's just focus here on the hospitalizations, that right now, the 55 to 64-year-old age group is 19%, which is the highest range here for Broward County. But when we go down to the deaths, you could see that really the 75 plus is where a majority of those deaths are occurring. And you can see here that as far as deaths from 0 to 4 in Broward County, 0, only 1 in 5 to 14. So you can see how that trend from new cases is up into the younger people. The hospitalization trends into the middle age, and then the death trends down to the elderly. And so this is something that is something that we've lived through, we've seen, and I think all of us have expected. Now, I think what will happen over time, now that the younger folks have gotten infected, what we anticipate, unfortunately, is for the hospitalization rate and the new case rate to start to drag down into the older crowd, and the deaths are going to start to stack up, I think, still in the older age groups more specifically. So I hope that answers the question.
Thank you, Doc. It does. And I'd like to hit on a couple of points here as we begin to close out our Facebook Live. If folks have COVID-19, it's very, very important that you stay home and you don't spread this disease. If you're a young person, if you're going out, if you're spreading this, it's important that you don't do that. It's important that you take proper precautions to protect our most vulnerable population. This community and this state has a significant amount of folks that are very vulnerable and very susceptible to this disease. They're relying upon all of us who may otherwise battle this and survive, but they're relying on all of us to do our part to keep them healthy and safe. And so I want to remind everybody that there is a Broward County emergency order that requires you to wear a mask. It's not a suggestion, it's not an ask, it's a requirement to wear a mask. The reason that we ask you to wear a mask is because when both parties are wearing a mask, if you're talking to another individual, it cuts down on your chance of catching COVID almost by 100%. We've looked at various studies, we've looked at various scientific data, and it proves that the most effective measure that we can take right now is to wear a mask. And so I want to reiterate that to all of our folks watching this and to all of our residents, just how important that is. I also would like to keep you guys up to date and informed of all city actions. The best way to keep involved and to stay informed is to follow our social media pages, to visit our website, www.carlsprings.org, or to keep in contact through one of our various hotlines. You can reach our call center at 954-344-1001, and you will be connected directly to city staff who can answer questions that you may have. If you're a business, you could also contact us on our business assistance hotline. That number is 954-344-5772. We are providing assistance to business throughout this COVID-19 pandemic and will continue to do so as long as it's needed. You can also stay up to date with community text alerts by texting the keyword Carl Springs, all one word, to the phone number 888-777. If you text that number, you'll get text updates on community events, on our testing sites, on our blood drives, and other important information from the city. Doc, before we close out, I just want to say to everybody at home, as a country, we faced numerous challenges. We've always risen to those challenges. We've always stepped up to the plate, and we've always succeeded. I feel confident that this pandemic will be the same thing. We've witnessed our Florida Department of Health, we've witnessed our healthcare facilities step up, move mountains to get testing going in a short period of time, to get additional beds set up, and to improve the care that they deliver to our residents. Statistics was shared with me, early on in this, it looked like folks who were put on a ventilator were facing an 80% chance of death. And some of the new treatments that are out there now, when folks are put on ventilators, the chance of them surviving is closer to 90%. And so there's a lot of good news coming out of our hospital facilities. There's a lot of good news coming from our medical professionals. And together, if we follow this advice, if we work together to isolate ourselves if we're sick, and we wear our facial coverings when we're out in public, we will stem this disease, we will prevent the spread, and we will be successful. So with that, I'd like to close us out. Dr. Antevi, I do appreciate your time here today. Our staff will continue to answer questions on the comments feed. And with that, I will sign out. I appreciate your time today. Thank you.
Thanks, everyone.